Before we go live, Tony, I just got to say that's a fantastic scarf.
You would know, Aaron.
And just so you know, we are streaming already. So, but it is a beautiful scarf.
Thank you, Danny.
Oh dear, people saw us being kind to each other.
Tony, you look like you moved to London.
Yeah, I moved to another zone, and it's cold in this particular zone. It's my wife's zone, and she likes it very cold.
Chilly.
And this was appropriate for me this morning.
Well, I'm looking at that bus behind you. Doesn't look like one of ours.
Yeah, no, that's Strathcona is going to change their colors to red.
Livery? Yeah.
Yeah, they're going to convert to red going forward, from what I hear.
Then they can get some buses cheaper, probably, on the used market.
Yeah, they're going to get used ones from London.
Good morning. We see a private caller on the line. Can you please identify yourself, please?
You have Deputy Chief Kevin Brzezinski.
Perfect. Thank you.
No, it actually turned out that the contentious one had to be pulled back anyway.
Yeah, that's what I heard. We'll get started in a moment, folks. Okay. Welcome to the January 27th, 2021 Emergency Advisory Committee meeting. Thank you for making yourselves available in this found time for a timely update on the continuing challenges with COVID-19 here. I'll roll call here, starting with Councillor Esslinger.
Morning.
Morning. Councillor Hamilton.
Good morning.
Morning. Councillor Henderson.
I'm here.
Thank you. Councillor Knack.
Good morning.
Thank you. Councillor McKean.
Good morning.
Morning. Councillor Nickel.
Good morning.
Morning, Councillor Paquette.
Good morning.
Morning, Councillor Walters.
Present. Good morning.
Morning, Councillor Banger.
Good morning.
Thank you, Councillor Cartmel.
Good morning.
Morning, Councillor Caterina.
Good morning.
Thank you, and Councillor Zanuck.
Here. Morning.
And I hear you did well chairing the public hearing yesterday. Thank you for doing that as I was called away to other business. Well done.
Thank you. I learned from one of the best.
Oh, that's sweet.
You stop.
Councillors, Councillor Essinger, would you be so kind as to move adoption of the agenda for this meeting?
I'm happy to move the agenda.
Thank you. It's fairly straightforward. We just have the verbal report as usual, which is an information report, not a recommendation around a state of local emergency, just for those following along at home. So I think we can just take unanimous consent. Any objections to the agenda as presented? Not hearing any. That's carried. The minutes from January 7th, Councillor Knack.
Yes, thank you, Mr. Mayor. I'll move the adoption of the meeting minutes from the January 7th, 2021 Emergency Advisory Committee meeting.
Thank you. Any questions, concerns, errors, or omissions? Hearing none, we'll take unanimous consent for that too. If there's no objection, the minutes are approved. Protocol items. Don't think we have any this morning. So let's dive straight into the only item on the agenda, which is item 3.1, the COVID-19 update verbal report. Thanks for pulling this together on fairly short notice and arranging for AHS to join us as the situation is fluid this week. So, Mr. Corbould.
Thank you, Your Worship and Councillors. With me in the chamber today, we have Bonnie Andriachek, our City Solicitor. Joining me remotely is Jennifer Kluth, the Chair of the COVID-19 Task Team, all members of the Executive Leadership Team and some of their staff, and of course Dr. Chris Sikora, the Edmonton Zone Chief Medical Officer of Health, and we thank him for being here today to help us with this discussion. Got this slide up. So there is good news to report about our epidemiological status in the Edmonton zone. Edmontonians are to be congratulated for their efforts to reduce COVID-19 transmission over the holidays. They made sacrifices to limit social gatherings outside the household, and because of this, we are starting to bend the active cases curve down. We need to temper this news with reality that we are still in a vulnerable place and we cannot ease up on the basic measures and current restrictions: physical distancing, wearing a mask when indoors, washing hands frequently, and avoiding social gatherings outside the immediate household, and of course staying at home if you are not feeling well or showing any signs or symptoms. I'll provide an update on the vaccine rollout and the City of Edmonton's assessment of possible roles we can play to support effective distribution of the vaccine. And finally, we will share what we know about the emerging spread of 2 COVID variants in Alberta. The health impact of COVID-19 in the Edmonton zone continues to be serious. It seems we have passed the peak in active cases for the second wave. We may have turned a corner, but we are not out of the woods yet. Current restrictions to minimize social gatherings will likely be in place until the strain on the health system is reduced further. Recent data show the trend for active number of cases, hospitalizations, and ICU admissions is tracking in the right direction, but they are still too high. The trend in outbreak locations remains a significant issue and is a consequence of broader community transmission. AHS is reporting increases in acute care, long-term care, and extended care facilities. Public compliance with the restrictions continues to be very good. For the week of January 12th to 19th, the rate of compliance for mask wearing, physical distancing, and gathering in public spaces was 98%. We are encouraged that the message of individual and collective responsibility for limiting the spread of the virus has been accepted by most Edmontonians. Administration is working on a detailed relaunch plan that will sequence recreation facilities, amenities, and programs restarting between 1 and 7 weeks after the provincial health orders are lifted. First priority would be to reopen those facilities that were operational until December 12th, 2020. Second priority is to open facilities that were approved by City Council in December budget deliberations. Relaunched facilities will continue to offer the same limited services that were in place in December, and planning We'll build in new services and programs to launch as health guidelines relax. We will do our best at managing the transmission in the here and now while looking forward to the vaccine rollout. The prospect of lasting virus protection for Edmontonians provides real hope for Edmontonians and is extremely important for adding back a sense of control to the lives and businesses of people in our community. We want to continue to build resilience and reassurance while we wait for broader distribution of the vaccine later this year. We cannot let up on the public health behaviors that will keep us safe in the here and now. The current short-term vaccine supply interruption has only added to the pressure to plan and execute an effective rollout plan. Simple, secure, and predictable access to the vaccine will ensure that the province's phased distribution efforts work. Dr. Sikora is here to answer questions about the province's plan, but I want to speak briefly to how it impacts the city. The City of Edmonton, along with the City of Calgary, are in discussions with the province to determine how we might support the broader rollout of vaccines in the public. Administration is ready, willing, and able to help this plan succeed in Edmonton's own, with potential involvement in transportation and facilities once vaccine supply improves. One of the options being assessed is for the city to establish and operate one or more vaccination sites and be responsible for the non-medical aspects of the program. We are developing a proposal that recommends the use of city facilities and options for parking and transit operations and access, community reach, and public accessibility. Wraparound services such as facility support, security, and people management. This will address responsibilities that do not require specialized training or medical certifications. Discussions with our community tables to determine the collaboration required with social agencies and community groups, what multicultural supports are needed to be in place, leveraging the city's communications infrastructure, network, and channels, coordination with neighborhood municipalities in the region, and of course, AHS being the prime contractor for the immunization sites. Vaccine rollout has implications for the city's workplace safety controls as well as the protection of employees and users of our program, services, and facilities, and we are exploring workplace vaccination approaches as well. Alberta Health and AHS have been clear that the phase of the rollout plan depend on supply from manufacturers. They remain optimistic that phases 1, 1A, and 1B vaccination targets will be met in Q1, even if that means working with a compressed time frame given the delay in some of the rollout. Phase 2 will begin in April and run to September. The key populations for this phase are still being determined, but will continue to focus on targeting those populations who are at risk. The province is taking a thoughtful approach to who will be included in this phase. The vaccine will be available to the general public starting in Phase 3, which is expected to be the fall of 2021. In the meantime, the expectation is that everyone continues to follow the public health orders and guidelines to combat the spread of the virus. 2 known COVID variants from the UK and South Africa have recently been identified in the province of Alberta. Public health authorities from around the world have yet to build a complete profile of their variants, but early data shows that they are more contagious than the original COVID virus. That means increased potential for more strain on hospitals and the entire health system. We are waiting to understand the effectiveness of the Pfizer and the Moderna vaccines against the variants. The spread of the COVID variants has been traced to international travelers. However, this week, Alberta Health reported the first case with no known link to travel. This presents a significant concern. Fast-spreading variants could introduce a new third wave while we wait for vaccine rollout, extending the delay of our economic recovery, thus the need to now remain vigilant in these coming days. We will continue to work with Alberta Health and AHS to learn about the effective practices to halt the spread of the COVID-19 related viruses, including these variants. Our work to manage the COVID has been effective in the short term, but there continue to be emerging issues that keep us focused and responsive. Our current challenge is to balance the multiple tensions. The active case data that causes us to be optimistic about our ability to control the virus, vaccine supply that is somewhat unpredictable, the news of community spread of the COVID variant and the risk of an exponential spread as a result, and of course the other tension is local businesses who are eager and some desperate to resume operations as soon as possible. Navigating through these stressors will require close collaboration with Alberta Health, AHS, and our regional colleagues, and we can never lose sight of the role the city plays in supporting the mental health of the community as we try to activate a path forward. I want to close this update by reminding the committee that we are starting to turn our efforts towards recovery and preparing for the longer-term initiatives that will secure Edmonton's successful economic exit from the pandemic. Bringing a strategic focus to our work with your direction is imperative, and we hope to stay on top of the opportunities for growth. Thank you, and we are happy to take any questions the committee may have.
Thank you. That's all timely and good context. So we've got a speakers list forming up here. Councillor Walters is first. Go ahead.
Thanks, Mr. Mayor. Thanks, Mr. Corbo. So just a few questions. Just in terms of vaccine administration, where does the people who work at the convention center with the homeless population fit into the timing for vaccines, and particularly those, there must be non-medical work or workers at the isolation space as well. So when people, I don't know, so you could comment on where they fit in and when they'll be vaccinated, if it's you or is it Dr. Sikora that's with us, or who's with us today?
Yeah, it's Dr. Sikora who's with us, and I think I can start on that. To say, I mean, stated simply, we don't have that detail yet. I imagine it would be in phase 2. And as I briefed, the province has not yet outlined specific recipients of the vaccine in that stage. And so we await that guidance and direction. And perhaps Dr. Sikora would like to add something.
Please.
Are you there, Dr. Sikora? He was.
Have we got Dr. Sikora on the line?
We do, and he doesn't appear to be muted.
Okay, we're having difficulty hearing you at this point, Dr. Sikora. Oh, okay, he's going to dial in. Have you got another question while we're getting him back on the line, Councillor Walters?
Yeah, I can come back, but I have another question for Andre, so I'll just ask that. That's fine.
Yeah, go ahead.
Now is just in terms of monitoring compliance on the things that we oversee. You know, how are we feeling about compliance on transit or any other services? How are we viewing or perceiving compliance to be in our business community? And then I have a follow-up to that.
Yeah, thank you, Councillor. We're feeling very good, 98% compliance on mask wearing. I also spoke with Chief McPhee yesterday, who had a similar perspective in terms of the compliance that they're doing. So I believe Edmontonians have really stood up and well to the challenge and are doing the right thing largely with that kind of a rate. So it's a very positive rate, and we're not having lots of issues with compliance or confrontations when we do educate first and then enforce.
So when constituents email us about spots where they see non-compliance, it's just a matter of, you know, who are we sending that to? Are we sending that to in through your office to our forgive me, the person on the call who's our pandemic manager now, our EAC manager. We just provide that through that information that will be followed up on.
Yeah, that's correct, Councillor. It's Jennifer Kluth, who is our task force manager, and we're happy to take those concerns, and we will do our best to get them to the right authorities to investigate.
Right.
Anything
Sorry,
Jennifer.
Total brain freeze there. I knew your name. So Dr. Sikora, can you hear now?
I can hear. Hopefully you can hear me now.
Okay, good. And if I could just have a little extra time, Don, just that question about where folks who are working at the convention center, and particularly at the isolation center, are in the queue for vaccines, considering they're directly with COVID positive cases.
No, certainly, and it's a great question. I apologize for my technical difficulties here. So they would typically be in our phase 2 approach, and of course, dependent on what our immunization, what we are able to get in for immunization product itself. So again, that phase 1B is our healthcare workers and medical surgical, and then COVID-19 units. But I think it's important to note that phase 1B and the phase 2 areas are still up for discussion. And of course, everything is dependent on getting product in, an adequate product to be able to do that phased approach. So there still is a lot of, there still is a lot of rearranging of deck chairs being undertaken around those phases themselves. And we want to do our best for all of our populations overall.
So would the isolation center, that's a COVID, is that considered a COVID medical unit? And are, some of the staff getting vaccinated and then some of them are in a later phase? Or would everybody who would be working in that isolation center, whether they're a doctor or a nurse or a non-medical professional, are they all getting vaccinated at the same time, or is that phased as well?
I'm not certain of that, Councillor Walters, but I know we are aware of our isolation centers themselves, and we would hope to really address them as a single entity or as a single unit overall. We do understand the higher risk, and I know that sequencing task force and the immunization task force is aware, and they're considering these.
Okay. Thanks. That's good for now.
Thank you. Councillor Essinger?
Thank you, and I'll just follow along that line of questioning, because I understand the next phase for vaccines, the groups involved, that hasn't been entirely confirmed, and I just wondered if we had a sense where fire, police, or some of our frontline workers are in that list.
Perhaps I'll start, Councillor, and say we don't yet. It's definitely considered as part of phase 2, but as Dr. Sikora said, that is being considered. We have talked about this. We have had conversations with the province about explaining some of the frontline concerns and needs at the convention centre with our first responders, but there's been no decisions made by the province, and perhaps I can hand it over to Dr. Sikora as well.
Yeah, and it's just to reinforce that the province and our partners at Alberta Health are making those decisions around sequencing and which phase particular groups would go into, and that the mentioning and the continued discussion around this is of critical importance, and still I think something that's very valuable. We all do very highly value our frontline workers, whether it be fire, police, EMS. And our folks working in our frontline environments of COVID care, and certainly we wish that everybody would be able to be immunized in phase 1, but there just isn't enough product for that. Hence, there is a need to be able to do this prioritization. As more product becomes available, we fully do expect that things will open up to be a little bit more accessible. Just in these early phases, the sequencing is important just because we have limited product.
Thank you. My next 2 questions are about the variant, because it hasn't been publicly said where the variant is in the province, into which zone. I'm not sure if that will come forward at one time. That's one question. The other one, because of the variant, do we have to change any of our cleaning protocols, thing like that? I was thinking of transit buses, places where the public is coming into.
Go straight to Dr. Sikora, please.
That's a great question. Alberta Health has identified that there has been about 24 cases of variant picked up in the province, and the vast majority at this time are all associated with travel. And it's not unexpected that viruses change and mutate over time. The difficulty with this new variant is that it has an observed greater chance of transmitting from person to person. Roughly 30 to 50 or 30 to 60% higher probability of really moving from person to person. And if So the concern being that if this does get a foothold in the Alberta or Western Canadian environment, that there is that possibility that it would become a dominant strain, and with more transmission events, that has the huge potential for more cases in a quicker form. So that our value that we've observed over the past several weeks, which is currently at 0.8, well, there's a good chance that that may go up if this variant does really take a foothold. The mechanisms to combat variant as well as regular COVID, and it's regular COVID, just has a slightly increased transmission potential, is that all of our efforts, this basket of services or this suite of interventions that we have been doing over the past year is all very critical to be maintained. So the vigilance and the diligence all of Edmontonians have really undertaken around physical distancing, doing the work from home options, the hand hygiene, the continuous masking, the early detection, the access to testing sites, and then the isolation should you be identified as a contact or isolation should you be identified as a case of COVID-19 are all critical to combating, of course, the regular COVID that we've had, but also any variants that seem to pop up that have a different transmission potential. So we do have to stay the course. I think that's been a consistent message from our partners at Alberta Health, and certainly has been part of the public releases and information releases over the course of the week.
Okay, thank you. My time's up. And maybe someone else. So the question is whether we need to up our cleaning processes in reaction to the variant.
I think the cleaning process that are in place using Health Canada approved materials with appropriate contact times are still perfectly valid for for any of these new variants themselves. And I think the protocols that have been put in place by the City of Edmonton and many business organizations, schools, hospitals, and public areas are all very appropriate and can and should definitely continue.
Thank you.
That's really helpful. Thank you. Councillor Knack?
Thank you, Mr. Mayor, and thank you for the presentation, and to Dr. Sikora. And I know, so part of, you mentioned that maintaining diligence as we continue through this, and as you know, there's that fatigue that sets in with all of the restrictions. We've seen blips of where certain groups or individual businesses are like, well, we're not going to follow the rules anymore. We're sick of waiting. So I know there's no way, and I wouldn't ask you to say, what restrictions will be in place for the next X amount of months or weeks. But what I am curious about is that, so if we assume the vaccine distribution follows the schedule as currently outlined, do you think it is fair to say that there will still be some level of restrictions, even if it's something as simple as still physical distancing and mask wearing, until we've really made it through most of that? Do you see that as a likely reality?
I think, and it's difficult to say, Councillor Knack. When we look at the layers of interventions that have been undertaken around control of this, we have interventions at the of course broad-based municipal level, interventions at the business level, interventions in the public spaces level, like our malls, our schools, our hospitals, and those are all business-based or at least facility-based. And then we have those interventions that are at the personal level, the things that all of us decide to do on a daily or hourly basis to keep ourselves, our families, and our co-workers healthy and safe. The personal responsibility aspects, whether that be diligence and hand hygiene, diligence and physical distancing, and then the mask wearing, I suspect are likely the last ones to be changed, but those are also the ones that are most variable. There's various uptake. There's a high amount of variation in their uptake, their utilization. We've discussed previously the the variety of masks that are out there, the importance of donning or putting them on and then taking them off appropriately, and that's fine. That's fine. But when most people do all of these activities, there's significant impact and reduction of transmission, and that's overall a good thing.
Mm-hmm.
But I know our partners at Alberta Health are monitoring carefully the numbers, monitoring carefully entry of variants into the Alberta and Canadian context, working very closely with our partners in the federal government around quarantine and travel and everything like that, and are making, I think, the best informed decisions possible around those almost facility-based or population-based recommendations and changes.
Sure. Okay, thank you. And the reason I ask is this is the question to Ms. Owen, I think, which is how we aid in the communication of trying to set realistic expectations for people in a time where people are fatigued, people have seen economic impacts, others have seen health impacts of this, and that desire to, like, can we go to Folk Fest or Heritage Festival this summer? Is that going to be possible? And if it's not, how we start trying to communicate so as to not sort of crush people's hopes, but at the same time provide that light at the end of the tunnel to say, by continuing to do these things, by continuing to drive this down and not see that third wave, this actually, in fact, gives us the best chance to have those things that we look forward to in the most timely way possible. So how do you see that sort of communication? Because I feel like we're at that point now where, again, and it's been that way for a long time, but tensions are high. They're seeing numbers drop. This is encouraging. So let's reopen everything tomorrow. How do you find that balance in trying to communicate that?
It is very difficult. Sorry. It is very difficult to find that balance, and I know our city has a proud heritage of being a festival city, but also a winter city. We pride ourselves in the outdoor environment. We pride ourselves in getting together to celebrate as communities. But a lot of those planning activities do have drop dead dates. And when is the last date possible to either modify or adjust? And that's a difficult place for many of the organizers to be. And certainly we appreciate that. And apart from, and I don't have awareness of a roadmap, a very specific roadmap of what the reopening strategy is going to look like. We do have the roadmap from our provincial colleagues, and we're still on that level 2 or that phase 2. So we don't have full opening, and I think at this point it's best to stay in our current state, just given our concern over variants, our concern over continued spread. When we look at our hospitalizations and our hospital numbers, we still have very high rates of hospitalization and use of intensive care spaces related to COVID-19. So we aren't out of the woods yet from a healthcare system perspective. And we're being stressed on a daily and weekly basis. We do have to maintain that constant pressure of stopping transmission, staying healthy, and taking care of each other. I understand the balance.
And Councillor Knack, would you like me to layer in some thinking to that as well?
I'm out of time, so I can come around for a second round and let you answer that, just so I'm not respecting other people's time. So I'll come back.
Thank you. Councillor Henderson.
Yeah, Dr. Sikora, you may not be able to answer this question right now, and I realize, but just in case there's an answer for it, so that we can begin to think in those terms. I mean, if the other 2 more contagious variants do take hold in Alberta, what's still left in our toolkit I'm hearing that the best response to them is doing well with with all the things we currently have in place. But are there other things in the toolkit that we may have to consider if we see a much more contagious variant taking hold?
It's a good question, Councillor Henderson. I think the tools that we have in our toolkit that have been deployed, it's that full suite of services and full suite of control mechanisms that we have done and that our Edmontonians and Albertans are all adhering to the best ways possible. Are all the ways that we help control this, and these are the exact same control strategies in areas where the variant strain has, or variant strains or variants, more contagious strains have been more prevalent, like the United Kingdom and such. Now, several of those countries have utilized different approaches in terms of international travel. Certainly that's not our purview at a municipal or our provincial level. Rather, that's more at a federal level. And I know that the federal government, in at least some of the recent media releases, are looking at various mechanisms or other tools that they may have to help limit some of that international spread. But it's a very fine balance.
Yeah, and I know they've done some more draconian things elsewhere, and that's why I'm just wondering if those are the. I mean, I asked the question not because I obviously hope it will happen, but so that we understand that if we drop our guard right now and these things do take hold, there are some more things we might have to consider. Is that, and other, I think Britain certainly did. Is that a fair thought?
I think it's a fair thought. Any of those further restrictions, of course, would be carefully.
Oh, absolutely. Yeah.
Yeah, carefully considered, and primarily at the provincial level.
Yeah, but so the easiest response is to try and do well what we're doing right now to make sure they don't take hold. Yes.
We have to stay the course. We have to do what we can, both individually, collectively, as organizations, as a municipality, as communities, to continue on with how we have been doing well. Well, if we look at that curve over the past 8 to 10 weeks, we had a sharp rise, and now we're on the latter half of that particular curve.
Yeah.
That's a testament to the amount of work that's been undertaken by Edmontonians to help reduce COVID-19 spread.
Great, thank you. I have an entirely different set of questions I'm just out of curiosity for administration, and maybe I'll preface it by saying, well, what I'm curious about is there clearly people are really taking advantage of our outdoor facilities, our outdoor things. I mean, I go by Victoria Oval fairly regularly, and it's packed, which is great, and I also really appreciate that we've had parking people monitoring that, which it's got to be a significant expense for us. But I'm impressed by the way we're handling that. So kudos to everybody for that. I'm really curious though to know. I mean, so that's one obviously is being really heavily used. I suspect the Gold Bar facility is being heavily used. I'm just wondering with those outdoor facilities, with what I think is a good news story, which is this big pickup of use, how we're doing on capacity with that. And we may not have that answer now. I'm happy to wait for it if we don't have stuff ready, but it'd be interesting to know if we're having capacity challenges. It looks in Victoria like we have parking challenges, but the overflow parking looks like it's always got space in it. But I just wondering if there's other places where we have more demand for outdoor use than we have capacity.
Yeah, Councillor, I haven't heard of any concerns with capacity, so I believe that we don't have capacity issues, but I'll just offer it up to if any of the ELT members want to.
Yeah, I'll jump in quickly. Thanks, City Manager. You're correct, Councillor Henderson. Victoria Oval that would be one of the pinch points, basically. It opens at 10 in the morning, and often the parking lot gets full shortly thereafter. People are waiting to get on the ice. So in some nicer days, we do have to turn some people away. So that is a challenge. And maybe Mr. Jevney, if there's other sites in the city where we are kind of over capacity. But
well, we have Harlack open now, so that should take some of that pressure off.
It should. Maybe Roger, anything else to add?
No, we have, we're reaching capacity at all the sites during peak times. They are busy. We're using the strategy of monitoring the parking lots and shutting them down to deter people from coming in, letting them know before they get out and get their skates on. So, we do have monitors on those sites, and things seem to be going well. People seem to be respectful of the crowds and the direction of our staff.
Yeah. And Gold Bar's fine. I'm out of time, but that would be the other one.
Yeah, Gold Bar's been very busy. The club's been maintaining the trails, but I would say all the ski trails have been busy, particularly when the weather was warmer. But it's being managed well, I would say.
Great, thanks. Just thought I'd check. Thank you.
Thank you, Councillor Banga.
Thank you. Thanks to each and every one of you for providing this information. And a couple of questions for Dr. Skora. Dr. Skora, could you tell me the magic number of cases per thousand, when we can say that we are into opening more areas for public use? What is that number, or is it a combination of numbers?
Well, it's a good question. I mean, at present, we're within the city of Edmonton. We're at about 230 cases per 100,000. When I guess early, or I guess mid last year, when we were going through the design, or at least the ramp up of this, we had two set points. One was 50 per 100,000. The second, I think, was 200 per 100,000. Now, those are important numbers, I think. To be able to consider further action and further activity, and certainly that's what was designed with our partners at Alberta Health. Now, a reopening approach would have to take into consideration the number of cases or active cases per 100,000. I think 50 is probably one of those important numbers, but there are a number of other things that have to be taken into consideration. That would be our hospital capacity, hospital utilization. If there's a variant, or there's greater potential, then those are all things that I suspect would be looked at. So it does have to be a general overview, yes, and not just a pure number per 100,000.
Okay, and just to I guess reiterate on some of those, probably I guess if I'm repeating, then please let me know. And vaccine rollout. I know there are all sorts of rumors flying around and whatnot. Is it going as planned? According to Alberta Health perspective, I guess?
I can't speak necessarily for Alberta Health. From what I observed in my role with Alberta Health Services, this was expected to be contentious. Sequencing is always a challenging activity. I think they've been able to put together the right people to have the discussion of how sequencing occurs. The infrastructure development is a completely different thing to discuss. Councillor Banga, you and I know our councillors would be aware that there are extra infrastructure requirements as a result of this vaccine that has been approved, or these vaccines that have been approved by Health Canada. And I guess to also mention the supply chain challenges of getting product delivered and into the hands of our vaccine people in Alberta. There are a lot of unforeseen variables, but in what I've observed, they have the right people making decisions. They have the right people taking things into consideration, and they're doing the best job they can, given all given the highly variable nature of both supply chain and the sequencing. So I think they're doing a very reasonable, good job, given the current environment. So it's set up, it's designed, it's going as well as expected, and there's going to be these hiccups, for example, around the supply chain issues, and we're being very flexible with that and making sure that we do good to our population and to our healthcare workers and to our residents.
Okay, and last question about variant is, I know it's being said that it's more contagious than COVID-19, but could you be able to tell me that if we as medical community, even you guys, and do we know enough about this variant?
I think
to say that, I know there must be some evidence saying that. How do we know it's more contagious?
So in environments where this was at least primarily identified, at least one of them was in the United Kingdom. So it's important to note this is all COVID-19. It's the same virus, and viruses through their replication process actually change quite easily. So that it's not unexpected that we would see variants occur. And we'll likely see many more variants over the course of the pandemic in the upcoming months to likely years.
Okay.
Where this was observed to occur and where it was first identified was in the United Kingdom, and they were able to show and demonstrate through a lot of the observational studies that, well, instead of there being maybe one case leading to 2 or 3 other cases, it was observed that number was much more, so that the variant was associated with an increased chance of transmission or increased chance of infection in people that are otherwise susceptible or at least are at risk. Now, from what was observed also is that it doesn't cause a more severe illness, it just causes a more higher number of them. So that if we have an uncontrolled environment, if in an uncontrolled environment where regular COVID-19 might cause 2 other cases, well, this new variant might cause 3 other cases. And that is a concern, hence the need for all of our continued efforts around reducing transmission events.
Well, thank you. I did have one question for administration, but perhaps somebody else will ask a question, and that's regarding the offer by us to the province if they responded in any way. Well, thanks a lot. My time is way up.
Thank you. Councillor Paquette.
Yeah, thank you, Mr. Mayor. I just want to pick up on that. So, because of what we have seen now, the R value and the potential of spread of B117, I've seen estimates that show that assuming 10 cases on January 25th and 50% increased transmissibility of B117, we can have 1,000 or more daily cases by March 23rd, or 2,000 daily cases or more by March 31st, based on current restrictions that we have now. So is there talk about what we're going to do? I mean, for example, I believe in Manitoba, they just closed their borders to interprovincial travel. And by the way, this math doesn't include the effect of schools reopening. So it seems to me that there should be maybe a little bit more concern here. And have we heard from the province about how they're going to approach this?
We haven't, but perhaps Dr. Sakura could add a bit more detail. Councillor.
I think and again, I can't speak for the discussions and the decisions that are taking place at the province. I think what we've observed together over the past week or so is that with the emergence and the continued worry around the increased transmissibility of this particular variant and any other variants that might be entering the Alberta environment, is that there has been a continued holding of our current restrictions and continued public communication around what each and every one of us can do to help reduce transmission events overall. So we're staying the course. We do have at present an R of somewhere around 0.8 across the province, which is it's the right side of the curve. And certainly we are encouraging individuals, should they have symptoms, to be tested. We've worked with our provincial laboratory, Alberta Precision Laboratories and Dynalife, to be able to ensure that we can test for variant to see, well, what is the status of it within the Alberta environment, and to, I think, adjust from there. But I know they are taking all of this into consideration. And at this point, it looks as if we're staying the course, which is the right thing to do.
Okay, so what we've learned already from other jurisdictions, so we don't even have to wait for an experience. We've already seen their experience. Their restrictions currently on the old variant, effective. The new variant with current restrictions, skyrocketing. So I guess that's just a concern that the public might have, and I know you can't answer that. So I guess we'll wait for that, for an answer on that. Okay, so moving on. When it comes to compliance, so basically what we've seen is that when people actually have rules to follow, they generally will follow them, and that helps. I'm just curious about administration's position now. So we just want to wait on the province to see what their moves will be, and we don't have anything sort of in our back pocket, or do we? If we deem that the moves from the province will be inadequate to save lives and reduce the impact or spread of this virus.
Yeah, thanks, Councillor. There certainly are other things that we can do. At this point, we're not recommending any of them for sure. I do believe the province is taking a very serious look at the variants. I think there is concern, and I think there's a lot of work going on in this right now. We'll continue to collaborate with them. But there are other things that can be done, as we've seen in other jurisdictions. But at this point in time, we don't have any recommendations on that. And we do think it's important that the province take a look at this and continue to work on any plans that they may have.
Okay, and I'll just put forward the reminder that other jurisdictions who have been proactive have virtually eradicated the virus from their population. And then when it pops up, they just take those measures in order to tamp it down. And people have gone on with their lives to live them as normally as possible again. And so if we have strategies for that, or suggestions for the province, we should certainly be implementing those strategies or making those suggestions. So thank you.
Yeah, thank you, Councillor. I just want to make it clear, we're not waiting. We have daily contact with the province. We're discussing it every day as part of the COVID task force. We're not just sitting and waiting. We are having those active discussions every day to make sure that we can be very reactive and very proactive to do the things we may need to consider.
Yeah, I understand. There's only so much we can do as a municipality. Thank you.
Any other questions on the first round? Okay, I've got a couple. Do we have anyone from EPS on the line?
Yes, Mayor, it's Kevin Brzezinski.
Okay, thanks, Kevin. Glad you can join us. So I was thinking a little bit about Councillor Knack's questions about the festival season, and hopefully we have widespread vaccination by late summer, early fall. Maybe there's still some opportunities for virtual events and so on and so forth. But I was really feeling what he was saying about the frustration of losing a second year. And I think based on everything we've just talked about additional transmissibility, the other challenges we're facing, that's a very real prospect. The juxtaposition of that with rallies of anti-vaxxers, anti-maskers, and alt-right hate groups continuing to gather and have mini festivals of their own is really starting to vex Edmontonians, including myself. And I recognize that there are certain circumstances where there is a challenge between legitimate protest and deliberate floating of the rules. And it's hard to determine what the intent really is there. But I am hearing more and more frustration from Edmontonians about the enforcement approach. Now, maybe first to Deputy Chief Brzezinski, if you could clarify again, you need to be, where these events are occurring on the legislature grounds, and I get a lot of questions about this still, but where these happen on the legislature grounds, that is the jurisdiction of the legislature, the speaker, specifically the sergeant at arms and the provincial sheriffs, correct?
Yes, sir, that's correct.
But when these folks wander off the grounds and parade around downtown, all of a sudden it is a municipal and public health authority enforcement question. So maybe to Dr. Sikora first, your interpretation of the rules, folks not maintaining distancing and not wearing masks, whether they're on the legislature grounds, which might be difficult for you to answer, but let's say they're off and on the streets of Edmonton wandering around, those would be clear violations of the public health rules. Yes?
I think as there are, or if there are violations, those violations can be reported to local law enforcement, and those may be within the public environment, maybe within business organizations, but those are often best reported to the appropriate law enforcement entity.
And that is both the City of Edmonton, because we've been delegated authority to enforce those public health measures, plus we have our own bylaw with respect to face coverings, and also to EPS, which has authority to enforce the public health orders. So the question I am increasingly getting is, why are we not more aggressively enforcing these? And I understand all of the tensions around this, but now with this more virulent strain at work in the community, and with less and less public patience for the the endurance that people are showing on their own part in juxtaposition to people openly flouting these rules. When can we expect enforcement to increase, where public health rules are being openly flouted on our streets?
So to answer your question, good question, Mayor. I think it's just trying to find that balance. Thus far, we've had peaceful protests or rallies at the legislature, which is under the authority of the sheriffs, and we do assist. But you are correct, as soon as they do enter some of our roadways, we certainly can enforce. We have a protest liaison position that reaches out to these organizers, and thus far, the organizers of these protests have been very forthcoming with when they're going to protest, where they're going to protest, and assure us that they are going to do it in a peaceful manner. We've seen other jurisdictions within Alberta and Canada where some of these protests become extremely unruly. The police don't have that intelligence so that they can monitor it properly. So to answer your question, I guess it's a matter of allowing or ensuring a peaceful protest versus having a violent interaction with some of these folks. When it gets to that point where we're not getting the good cooperation from some of these folks, perhaps that's maybe a point in time when we can do more enforcement. It's always on the table, and we do monitor it on a case-by-case basis, but thus far, it's been actually relatively successful.
Well, and sorry, go ahead, Andre.
I might add, Your Worship, that I think what we could perhaps do is provide you a bit more information on the enforcement that's taking place, because just because somebody doesn't get a ticket at the actual event that people may see on television or witness themselves, that doesn't mean that there's not enforcement after the fact. And we can perhaps provide a bit more data on that because sometimes it's important to make the call on when the enforcement is done. Is it done in the moment or is it done after the fact when things calm down and it's a safer way to do the enforcement? And so I think we can provide more data on that with in collaboration with EPS.
That'd be really helpful to send a message of accountability, that there is ultimately accountability for this behavior. So I appreciate that. Look forward to that. Thank you. Councilor
Mayor, I've been sorry to interrupt you. It's Kevin Brzezinski. Just for some stats, the EPS has issued 102 Public Health Act tickets thus far.
Okay, thank you for that. Councilor McKean?
Thank you. Thank you, Mr. Mayor, for your line of questions. I wasn't going to jump in, but I've lost all sense of humor about this. And one of the things I've heard about from a couple of constituents is being on a bus and somebody coming on and maybe taking a mask off or getting on the bus without a mask. I don't imagine it happens often, but in that situation, you have people who are afraid for their lives or afraid for the lives of their loved ones. And I guess I want an answer to be able to tell those people, because you're in a contained situation with somebody who could be infected and then infecting others. And like I say, I've lost all sense of humor about this, and I would like to know that we might be able to take more assertive, if not aggressive, measures in those cases to protect the people who are conforming to all public health rules and regulations to protect others. And then we have these scofflaws who are scaring people off our buses and scaring them to death. Mr. Corbould, I know you're new on the job, and I hate to throw this at you, but I think at some point we're getting really good compliance, which means that a few people are ruining it for the rest. And I think the day has come to take this very seriously. And I'd like to know if we are planning to do any of that or can report. Like, I think the bus should stop and another bus should pull up, and the folks that are masked up should be put on that bus, and the person that's not wearing a mask should be immediately fined. But that's just me. Can you? I see Mr. Aitken's on the call. David, what can you tell me?
Councillor McKean, we certainly understand, and we are hearing those concerns, both by the patrons on the bus and in the ETS system, and also by the drivers. And so we do have our peace officers deployed to take care of those issues. Within the last 20 days, I think we've issued close to 50 fines and public health order fines in response to that. And so it is a concern. We recognize it as a high priority for citizens. We are deploying our staff and our peace officers to respond to those issues. Obviously, there's always some resourcing concerns, but it is one of our highest priorities, and we continue to best manage those complaints in those situations to the point of having to remove individuals from those buses when those complaints are raised. So we can certainly make better effort to inform council of that effort and how we've upped the ante to be more assertive and even aggressive at times to remedy that situation.
Well, I think press releases to let Edmontonians know how many people were charged that week would be another way to let the public know that we're serious in protecting their health, and let scofflaws know that if they ride a bus or maybe they go on a protest march downtown, that there will or be consequences. I just think the days of warnings and education are over, almost 1 year into this. So that would be my attitude. I'm not usually a hard law and order guy on this, on stuff, but my God, some of the emails we've had are people are freaked out. They maybe need to take the bus, and some jerk gets on without a mask because he believes in conspiracies. I'm just sort of done with this. And so Mr. Aitken, maybe Ms. Owen, have we been doing those kind of press releases and I'm unaware of it?
We have not to this date, but your concern is noted, and your thoughts around how we might take a harder line on communicating consequences also noted. Thank you.
Yeah, I think
Councillor McKean, I'll just add that we do have a public-facing dashboard that provides daily enforcement, complaint, and ticketing information. So that is available to the public and to the media. So we can certainly look to highlight that enforcement response.
Yeah, I think a weekly bulletin to the media with, still media covers that. Some of them will rip and read the latest stats. And I think it's important, to let law-abiding citizens know that we're getting this kind of compliance rate, and congratulations for that. But B, scofflaws are being caught and they're being ticketed. I think that would go some way to dealing with the very issue that the mayor was raising earlier too. So thank you.
Yeah, and Councillor, I would just add that we agree with you, and that is certainly in line with our message of the day, which is we need to remain vigilant. So we will look at efforts to do that.
Thank you.
Councillor Knack on the second round. Go ahead.
Yes, thank you, Mr. Mayor. So just wanted to give Ms. Owen a chance to respond to what I was asking about earlier. You still have that question? Good.
Yeah, thank you. The word of the day of the morning appears to be balance. We have been taking our lead from the province and the health experts and giving Edmontonians information in those 2-week cycles that the province has been working with, more or less. Now taking a longer view, as you suggest, we have to figure out the balance between the actions that must be undertaken in the here and now and some sense of optimism for the summer and beyond. Where we would need to proceed very, very cautiously with any optimistic messages because, as you can appreciate, letting people down has greater ramifications than simply describing the current state. But we're working with the task force, we're working with our events people, we're working on that long view on an ongoing basis to see where we can be clear with Edmontonians about what they can expect. But our position always has been to take our lead from the health experts, and we're not deviating at this point from that, but recognizing that striking a balance is important.
Absolutely, yeah, it makes sense. I've been enjoying both the federal government ad that talks about, we're doing this so that in the future we can be doing this, not setting a clear timeline. And I also like the Alberta government COVID ads that COVID loves a party and all that. Those are just fun and entertaining, and they really strike a balance. So I wanted to know how we're aiding in that, because I don't know if we can commit. I'm mentally preparing myself that I won't have those things this summer again. And if we can, all the better. But I don't want to set my expectations, and I'm guessing then more broadly, we don't want to set the expectations that that's absolutely going to happen. But it's good to be upfront so people can sort of start dealing with the mental part of what we may or may not be dealing with. So I'm glad to hear how you're working on that. A completely unrelated question. I have had a few questions from folks. Might be really small, but we've had people who have reached out who said, "Hey, we bought passes for rec centers like a month before everything shut down, and they were to expire December 31st, 2020, and transit tickets." Are we helping out for those who bought things and haven't had the chance to use them? Is there any?
On the recreation side, Councillor, those will all be extended.
Okay.
As to when we can relaunch, so there'll be no harm to those individuals financially at all as we get our reopening plan in place.
Do we already have? I don't know because I didn't look. Do we already have some of that information on the website saying, "Hey, just so you know, if you had something that expired, we're going to extend it. We'll work out the final details later." But
we'll make sure that that's posted properly and clearly.
Okay, great. Same question maybe relates a little bit to transit. I know it's a bit different because the service has technically been still being offered, but if you haven't had the use to use your pack of 10 tickets because either you didn't have a job to go to or your job is now working from home, is there anything related to that for those that might have had something that expired this year or at the end of last year?
Councillor Knack, we have a number of different fare products that we manage sort of in different ways. So I'm going to ask Ms. Cotton McDonald just to provide a little bit of a sense of how we're dealing with each of the different fare products and the different user group.
Sure.
Thanks, Councillor, and thanks, Gord, for that. So we did provide refunds for folks that had the passes when there was that disruption earlier last year. And then for annual passes, we've also provided credits towards the price point for this year. In terms of ticket expiry, my expectation is that we'll facilitate something similar to make sure that people aren't negatively impacted. I'll follow up with the team to confirm the process, and we'll get you some details on that.
That's wonderful. Thank you very much. Those are all my questions.
Thank you. Councillor Banga? Councillor Banga? Okay, we'll come back to Councillor Banga. Councillor Paquette?
Yeah, thank you. And just to sort of pick up, I guess, I'm just curious if we have gotten any word from the province on why we are not following the model of successful jurisdictions who did a targeted lockdown for a short period of time so that people can get back to work. You know, I know that one of the concerns was mental health, but we've also seen the stats now that show that during these times, suicides have actually decreased. And so that was the major concern. So I'm wondering if there's any rationale at all for not just following the successful examples of successful jurisdictions to eradicate virtually this threat, which would render most of our conversation today moot. Do we have that justification for why we are not following those successful models?
Yeah, thanks, Councillor. I believe what's been expressed by the province has been done at those press conferences, primarily from the elected officials at the province, who have expressed why. And my understanding of it is it's a balance of economic development in the middle of the pandemic. But that is what.
Let's interrupt you there for a second. The models show that that actually doesn't. That doesn't actually hold water. A short targeted lockdown leads to a smaller economic impact than extended softer measures. So if that's the reason they're giving, is that the public reason, or is that, I'm just wondering if there's something that we're missing here.
Yeah, and I'm not arguing on that point. I'm just, that's what we have heard from the province. They're taking a balanced approach. Whether we agree with that or not, that's what the explanation has been at press conferences and by the leadership.
Okay, well, if that's their reasoning, okay, and I guess that's that. Okay, thank you.
Thank you. Councillor Banga, are you there?
I am definitely here, sir. Couple more questions. One is, I know that he has offered to the province in any way to, in the scheme of vaccination, have accepted our effort, or at least even considered anything about what we have offered.
Yeah, thank you, Councillor, for the question. So far, we've communicated with the province. We've explained to them what we're prepared to do in terms of what I described earlier, in that we're ready, willing, and able to support the vaccination. They are aware that, in general terms, we're putting details together. We're also working with our regional partners and other jurisdictions such as Calgary, because we're kind of doing a very similar thing. In terms of what we're offering. We haven't got a formal request, nor have we got a formal acceptance of those offers, but we are communicating on a daily basis. And I'll just see if Jennifer wants to add anything to that detail.
Thank you. And yes, Councillor, we are absolutely in contact with the province. And right now, when they have the variables a little bit more known, which are when vaccine supply would be available, and then how the larger mass vaccines potentially would enhance the pharmacy rollout. At that time, we have some options for them and are ready absolutely to support. Does that address your question, Councillor?
It does. My next question is for Ms. Owen. I know all levels of the government, and basically it's the same message, and that's what the message should be. However, these messages like wash your hands, stay home if you're sick, avoid public gatherings and whatnot, I mean, they're becoming monotonous. Is there any way that the city is trying to somehow, I guess the message is the same, but just how make the tone more interesting so that people are actually paying attention to it? Are we doing it, or how we are doing it if we are?
So our role thus far has been to be interpreters and navigators of the provincial rules, essentially saying to Edmontonians, this is what it means for you. And so to this point, we haven't chosen to do a breakthrough communication strategy like the province with COVID Loves to Party. But as of the new year, it too is on our minds that fatigue and tedium with the regular messaging is prevalent. And we are looking as a communications department at how we might do some more visceral, penetrating communications to get through to people what's important. Always, of course, taking our cue from health experts, which we are not. But it's on our minds. We're thinking about that very issue as well.
Thank you so much.
Thank you. Councillor Walters?
Thanks, Mr. Mayor. So, Mr. Corbo, I just wanted to follow up on some media yesterday about the province leaving a certain amount of money, federal emergency funds, unspent. And, you know, you may not have much to offer on this, but I wonder about, you know, particularly in terms of our rapid housing needs and our increased needs around shelter provision, whether some of that money that has been noted as unspent would in fact help us deal with the pandemic in terms of increasing people's safety and our response to it.
Yeah, it's a great question, Councillor. Unfortunately, I don't have a good answer. I might see if Rob Smythe has something to add to that, or Jennifer. But I can certainly take that away if not. Go ahead, Rob.
Certainly, Councillor, not specific to that funding, that source of funding, but we've been talking to Community and Social Services and AHS in terms of how we deal and support our homeless population. As you're well aware, our facility that we've activated is only going to be activated for another few months, and there will be a requirement to, provide housing, even if it is short term, for those individuals. So we do have those conversations going on, but we haven't identified that source of money specifically to meet that need.
Right, and I know that, the money that we're asking for in terms of what comes after the emergency accommodation is, ongoing operating. So this may not be the appropriate pot in terms of it being one-time emergency, but there's got to be some bridge if, we're on this, merry-go-round of, being on our hands and knees, begging for operating money from the province for the capital that we've talked about at length here over the past number of years. I don't know if any of this money can be some sort of bridge to that ask being fully, fulfilled eventually by a provincial government. So I would just raise that is it, while it may not be ongoing operating, is it beyond just the rapid housing that we're talking about now? Is it going to be used as some kind of bridge funding potentially?
Councillor, don't have an answer to that question, but we can certainly circle back with our CFO and explore some options in terms of how that funding could be focused on in terms of the issues you've raised.
So I can step in a bit, Councillor. We are in ongoing discussions with the province around that. Some of that money is earmarked, and that was a third-party comment, so getting the accuracy of that statement is also something that's top of mind for me.
Oh yeah, for sure. And I just raise it as a question that has been raised. I appreciate it may not be precise in the assertion, but okay, thanks. That's all, Mr. Mayor.
Thank you. Any other questions? Got one that's maybe a little bit more longitudinal, which is, and Andre, you and I have had a good conversation about this, and it's sort of come up a few times today, but as both in the short term, but especially in the medium to long term, the mental health implications of this degree of stress and anxiety globally, but those are going to show up at the community level in terms of economic confidence, in terms of substance use disorder, in terms of domestic violence, and sense of community obviously is contingent too. So curious your thoughts about, I mean, again, it's strictly speaking provincial and federal jurisdiction, but opportunities we might have as a community to support our own employees, even in this organization from a mental health standpoint, our community partners who deliver important services for us, many of whom are on the front lines of mental health. Thoughts about how that fits in the recovery conversation?
Yeah, thank you, Your Worship. I believe that this will be the most important and the most long-lasting aspect of our recovery. The mental health, once the pandemic physical health issues have been resolved, ideally with enough people getting the vaccination so it's no longer a threat to society, I think the longest term part of this will be the mental health of the entire population. So sadly, I think there'll be many opportunities for the city to get involved with this. This will be a main and the longest lasting stream, I would suggest, of our long-term recovery. I think there's going to be federal, provincial, and municipal focus on this. I think there will have to be. I know those discussions are going on. And certainly recently in the last year, we've been thinking a lot about this from a school perspective in the Department of Education, because it's so critical that our youth is going through something that many of us have never had to go through as youth. So we don't have it all flushed out. We will be coming back to council with a long-term recovery plan, and I can assure you that it will include a predominant focus on mental health, not just what the city can do, but who we need to go to for help and collaboration and assistance. So it will definitely be the longest part of this.
And if I may add to this, Mr. Mayor, we've already begun a foray into this space, working with the Edmonton Public Library on a video series called Random Acts of Connection, intended to reach out to those who might feel isolated or disconnected during the pandemic with messages of hope and resilience, using community experts, mental health specialists, hope practitioners. So it's a small foray in, but it's an example of the kinds of things we may have to amp up as we recover as a community.
And just one thing I'll add, Your Worship, is that, because I didn't answer the question about our own staff, I believe we have a legal and moral responsibility to look after the mental health of our staff. If for no other reason than the occupational health and safety requires it. And so as part of the recovery plan, we will definitely have an internal focus on city staff to make sure that they are taken care of properly. And that's something we will collaborate with the unions on as well, to make sure we have a collective plan to deal with that directly.
Well, that's very comprehensive and further even than some of our preliminary conversations. But I wanted members of council to hear from you that that's on your mind as it is on mine. And I'm really encouraged. First, on the leadership by example with our own organization, our own staff, their health will be their effectiveness going forward, short term and long term. So thank you for that. And the leverage with the library, I think, makes a lot of sense. There is so much cynicism with government right now for any number of reasons. Local government, I think, is not immune from that, but does have some distance from some of the cynicism directed at other public institutions. But it's our partner agencies, particularly the library and many of the not-for-profits that we work with, and police and fire and others who have credibility with our public as agents of their safety, who I think can be mobilized in a variety of creative ways. So I'm really glad that that's on your radar. Ms. Owen, and very glad that that's top of mind for you and your important role as our new city manager, Andre. So thank you for that. Councillor Essinger?
Subsequent to that, and I really appreciate that line of questioning, I'm wondering if, as part of the work for our own staff, are we giving them support in how to deal with angry citizens? Because many people have that angst and anger, and it's got to be challenging, I know, for my staff, but for others throughout the organization as they deal with people. Are we ramping that aspect up? Because I think it's a challenge we're all facing.
Thank you, Councillor Essinger. I believe we do have those tools and protocols. I don't have a recent update if we've reinforced them with our staff. It should be part of our continuation training for staff to deal with difficult customers and clients. And I might just see if Miss Armstrong is on the line, if she wants to comment on that from an employee services perspective.
Sure, and thanks for the question, Councillor. We've recently actually launched the Connected City Initiative, which is focused on supporting our folks to have the very best possible relationships with individuals that they encounter in the public. And accompanying the launch of the initiative were a number of tools, everything from personal resilience prep type activities to conflict de-escalation type techniques. In addition to what I'd call the outward-facing aspect, as Andre earlier referenced, we really are continually communicating to our folks about not only the services of our chaplain and his office, but also our employee family assistance program. We recently went with the new provider, and they have extensive online type supports available, and so we are really not missing an opportunity to reinforce that support system for our folks as well.
And I would just add, Councillor, that leadership throughout the organization has a legal responsibility to do hazard assessments as well. And those hazard assessments are not just physical hazards, but they include the mental health hazards that this kind of activity can cause.
Thank you, and I appreciate that, because I think this is part of the challenge we're facing. You also had mentioned recovery, and I am concerned about a number of nonprofits who they can't do their traditional fundraisers. They're challenged, yet they're really functioning with great demand at this time. So I think we're going to have to think about how do all the organizations that serve our citizens into the future as part of the recovery and any gaps that show up. Is that on your radar? I just wanted to make sure.
Yes, it is, Councillor. I'm seeing that myself as the Capital Region Chair of the United Way Cabinet. It's something that we've worked on a lot with their funded partners as part of our planning through COVID. And I know that Ms. Owen and I are going to sit at some tables within the community to have this very discussion about how we can assist and work together to move that forward. I would say, though, that the citizens of Edmonton have really stepped up as well, because we have seen a lot of continued support for those organizations in many circles.
Yes, and I think Edmontonians are trying to support, and I've heard from some local businesses how they have felt supported by citizens, so that's great. Thank you very much.
Thank you. Any other questions? Not seeing any. Then I'll just need a motion to receive the report for information.
So moved.
Thank you, Councillor Henderson. Okay. Is there anyone wishing to speak to that? Or can we go to the vote? Okay, let's vote.
Yes, Zadok.
Yes, Sarah Hamilton.
We have all the votes, Mr. Chair.
Great. Display the vote, please. Carried unanimously. All right, that's the business for this morning. I guess one other quick question. We still haven't scheduled an EAC.
We have a report coming to council on Tuesday with several dates for upcoming EAC meetings. The next one that is proposed is February 10th.
Okay, so we were aiming for at least once a month, and so that will satisfy that requirement to check in again next month, which is good. Okay, because I think these are important, just to stay on top of the situation. So, Councillor Henderson?
Just while we're here, assessment and taxation, I think we're wanting to give us a briefing at the same time, which I think is probably movable, but we might want to give them a heads up as well for that February 10th date.
Is that the information session?
Yeah.
Okay.
Yeah.
Thank you.
I'm sure that's easily moved. It's just, if we're going to use that date, we should let them know.
Thank you.
Okay, thanks for flagging that. All right. Well, thanks for making yourselves available during this repurposed overflow time. We are adjourned for now, and enjoy the rest of your day.